Franciscan St. Elizabeth Health is restricting hospital visitation to prevent the spread of the flu. Children under the age of 18 must be with a parent, and only healthy adults who are immediate family, including partners and significant others, will be allowed to visit patients. Anyone with flu-like symptoms in the last 7 days will not be allowed to visit patients.
Now, this is all in response to the flu outbreak that has so far claimed 27 lives in Indiana alone. 2 of those deaths were children under the age of 18. News 18's Holly Campbell reports pediatricians say there are ways to help protect your family, even if your child is too young for a flu shot.
Flu season is here and Indiana is getting hit hard. 27 people have died from the flu, and 2 of those deaths were children under the age of 18. Dr. Timothy Snyder says it's something that needs to be taken serious, especially when there are young children in the home.
We have seen the flu here in Lafayette. In our practice, we've had 1 or 2 kids with the flu.
Children can get their first flu vaccine when they're just 6 months old, but Dr. Snyder says it doesn't always work.
We've actually had a child who tested positive for the flu that had the vaccine. So while we encourage everyone to get the flu vaccine, we recognize even those vaccinated, still there's some risk.
If your child is too young for the vaccine, there are some important steps you can take to protect their developing immune system. In addition to washing your hands, getting plenty of rest, and staying hydrated, Snyder says the best way to protect a young child who may not be old enough to get the flu vaccine is by first protecting the rest of the family.
We encourage family members to be vaccinated. If there are school-age siblings, we encourage that they be vaccinated because most likely they will bring the infection home from school.
Lafayette School Corporation Nursing Coordinator Sue Bergstrom says it doesn't take much for the flu to spread in schools, and says if your child is showing flu-like symptoms, keep them home from school.
And if kids are here at school with a fever and they're coughing, within 6 feet those germs spread, and so it can go quickly. So we're not seeing that right now, but it's good to keep alert, and the nurses are all alert.
School nurses are tracking absences due to flu-related illnesses, but Bergstrom says the number of children missing school because they're sick isn't out of the ordinary for this time of year, and taking preventative measures to stay healthy and avoid the flu will only help that number go down. Holly Campbell, News 18.